Welcome to Wednesday's edition of COVID-19. There has been a rebound in daily infections, raising our tally here back to the 400 level. Meanwhile, over 700,000 people have received the first dose of the COVID-19 vaccine here in the country. And we have more on related news later on in the program. Let's start now with the pandemic updates. Now, Soa, do tell us about this latest surge in cases here in Korea for this Wednesday.
Sure, Sunny. The country reported more than 80 cases more than Tuesday. With that, the number has rebounded back to the 400s with 428 infections as of 12 a.m. And that also includes domestically transmitted cases in the 400s. So infections that is have spiked back to the triple digits here in the capital. Not a big change in Gyeonggi-do province, and Incheon as well as Gyeongsangnam-do province are seeing over 20 new infections. And apart from a one-day plunge to the 300s on Tuesday, we are not seeing many fluctuations throughout the past week. And if we do see another similar number, the country soon will be at 100,000 cases in total, currently at 99,846, with a death toll at 1,707. And let's also get an update on the vaccination front. With some 20,000 vaccines administered on Tuesday, the total number of people who received their first dose has surpassed 700,000. And also the number of people who got their second shot is close to 1,500. And meanwhile, around 7 out of 10 Koreans want to get vaccinated for COVID-19. This according to a study by the government, which was conducted last week for 2 days. Out of 1,000 adults, 968 or almost 68% gave their consent towards receiving a shot, while a little less than 13% answered they do not want to get vaccinated. And around 19% have not made up their mind yet. 80% chose the well-being of their family members as the main reason, followed by achieving herd immunity at 67% and 65% for their own protection. And multiple answers could be chosen. Now, from the vaccination campaign to the election campaign, which will start on Thursday, with 2 weeks left until mayoral by-elections in the capitals Seoul and Busan, Prime Minister Chung Se-kyun called on thorough preparations for a safe election, noting that while Korea conducted general elections, much bigger elections last year amid the pandemic, this time around we are seeing much higher numbers of daily COVID-19 infections.
Right, we are, of course. So, meanwhile, on the international front, Brazil's death toll is causing much alarm here.
Right, Sunny. 3,251 deaths have been reported in the South American country on Tuesday, which is a record high for a daily death toll. And this is overwhelming the country's hospitals as well as cemeteries, as you can see here. And soon, Brazil is expected to see 300,000 fatalities in total. And also, if we take a look at the numbers here, Brazil also had the highest number of daily infections in the past day, almost at 85,000. Followed by nearly 60,000 in the U.S. and over 47,000 in India. Let's also take a glimpse at the 20 worst hit countries in the world by infection. We are seeing France having surpassed the UK in total cases, now at 4.3 million and over 15,000 new infections. And also Turkey saw some 26,000 infections in just a day. And with that, the total number of infections around the world stands at around 124.8 million, with some 2.7 million deaths. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for the update. Right, now let's shift back to vaccination efforts here on the local front. I have Kim Hanul in the studio with me. Welcome, Hanul.
Good afternoon. Right,
so I hear a fresh batch of Pfizer vaccines have arrived here in Korea.
Yes, Pfizer vaccines enough to inoculate 250,000 people have arrived at Incheon International Airport this morning around 7:45 a.m. These vaccinations will be administered to the elderly who are age 75 or above. This is around 2% of the total number of Pfizer vaccines procured by the Korean government, which is intended for 13 million people. Upon arrival, they were delivered to 46 vaccination centers nationwide, and those aged 75 and above will be receiving these shots from April 1st. Korea currently plans to bring in enough Pfizer vaccines for 3.5 million by the end of June. In addition to today's arrival, another batch of Pfizer shots for 250,000 people will arrive at the end of this month, with the remaining 3 million to be delivered over the next 3 months.
Right, and along with that procurement, I hear there have been more words by the government in favor of COVID-19 vaccination.
Right, during a government meeting today, Prime Minister Jung Se-kyun said vaccinations are the strongest means of protection against COVID-19, especially for the elderly. And he reassured the public for the safety of the vaccines. Take a listen.
We ask people who are 75 years of age or older to trust the government and get your vaccines. If you have elderly parents, support them and pass on as much information as you can so they can get vaccinated with a peace of mind.
The Prime Minister added that the elderly are most vulnerable to severe illnesses when infected with the virus and emphasized that it is the government's top priority to protect this high-risk group. However, Korean health authorities recommended that those who are 75 or older should not get vaccinated if they have the following conditions.
People with mobility impairments, those with speech difficulties to clearly communicate their needs, as well as others who may be putting their health at risk by venturing outside, will be excluded from vaccinations.
Right. And meanwhile, over 10% of all new infections reported this year affected school-aged children, I hear. Do tell us more.
Sure. So Korean health authorities say over 3,800 children under the age of 18 were infected with the virus as of January this year, which accounts to 10.7% of all confirmed COVID-19 cases. And among this group, children aged 7 to 12 appear to be the most vulnerable, taking up 33.9% of total, while 20.4% were those aged 3 to 6. The good news is that there were no reported school outbreaks since the new semester began earlier this month. However, cluster infections were reported at daycare centers and private academies. Apart from places of learning, the KDCA identified other prevalent infection routes among children in different age groups. Those aged from 3 to 6 frequently contracted the virus at medical facilities, those 7 to 12 at social welfare centers, and teenagers aged between 13 to 18 were most likely to catch the virus at churches. Meanwhile, Korean health authorities called on early childhood educators to practice rigorous prevention measures and send students back home and instruct them to get tested if they have any symptoms other than fever.
All right, Hannah, as always, thank you very much for that coverage.
Thanks for having me.
Right. In Myanmar, acts of appalling atrocity continue as armed forces crack down on protests against last month's coup. Now, for more on the situation there, we connect now to an activist in the country. Momo, welcome.
Hi, Stani.
Now, Momo, the military has been tightening its choke on the media, and internet services, I hear, remain precarious as efforts to stifle information about the resistance to the coup continue. Please tell us more about this, Momo.
Yeah, currently the government is totally shut down the mobile data usage. So no mobile data usage at all. They only allow to use the Wi-Fi internet connection, which is the short acronym is FTTH. The only Wi-Fi connection is available right now. So in our country, most of the rural areas doesn't have that Wi-Fi availability. So the internet is totally, you can say, totally shut down. And then they totally block the internet service from 1 a.m. up to the 9 a.m. every day. Even the Wi-Fi is okay. And also the, how can I say, one of my friends work at AP Associated Press News Agency, and then he has been detained since March, early days of March at Leiden. He stayed under the detain, and they charged against him 505A, which is kind of the violations to the government. So he stayed under the prisons.
I see.
So the condition is quite worse here.
Meanwhile, Momo, activists claim that at least 260 people have been killed thus far, but I hear the actual number may be quite higher than that. Could you tell us more?
Yeah, absolutely. Because they cracked down so brutally in Klang Daya, and then they issued the 144 at Klang Daya, and then the Klang Daya is the suburb of the Yangon, and then that area is the quite war situation here. They shot everywhere, and then they don't allow the people to take the dead body to. So that's quite, how can I say, quite devastating. And then they are the absolutely the manslaughter there. And then yesterday only they killed at least 6 people in the Mandalay Aupinle region, including 7 years old girl. The girls didn't do anything wrong. She just she just closed the door or something like that, but they shot her, and then at 7 years old girl died immediately at the spot. So it's quite, how can I say, I can't imagine what can they do next. We the protester don't have the the guns, but they have the weapons, the deadly weapons, the lethal weapons, and then they shot with the real gunfire, not the rubber bullet. Yeah, I can say.
Now, Momo,
I
you
can
mentioned
imagine.
that tragic loss of life of the 7-year-old girl who was shot by security forces there. And in light of that, I understand that today you'll be holding a silent strike. Could you tell us about that, please?
Yeah. Yeah, the silent strike is the nationwide protest day for today, especially we set for the military region. They wanted to show the international that they can control the protest, they can control everything. But we don't accept it. We demonstrated as much as they can, even they crack down brutally. So we set up the silence day strike. That aim is that we are not accepting them. This is our town, this is our city, so we are closing everything. That thing is not normal situation. We want to show the thing is not under the normal, and then we are keep silent for today. All the shops are closed, all the marks, banks, the business, all are closed. No one is on the streets. This is our silence day. And then also for the people, the victims, especially the victims who sacrificed their lives in this demonstration, in this fight for the democracy. Yeah.
Momo, you've been taking to the streets for about 2 months now. What can you tell us about the people who are partaking in this movement for democracy in Myanmar with you?
Yeah, at first, the protesters are quite okay, and then that we are peacefully protesting on the streets. And among Myanmar, every man, every level man, like including the businessman, everyone is participating in these demonstrations. We are asking for the democracy. We are asking for them, especially to the military hunters. We reject the military coup. We don't accept it at all. And then we are asking for the return of the democracies, and then please respect our vote, and then free the leaders and the detainees as soon as possible, because they accuse this election is a fraud, actually, which is not.
Momo, you mentioned how the protests that you are holding are peaceful in nature, but the response from the military has been quite brutal. How do you explain the inhumane response to the protests by the armed forces there in Myanmar?
Yeah, firstly, they are the first day of the military forces using is the dispersed. They came in the peaceful protester group, and then they ran away and something like that. So the protesters were running away, and then they detained the students, young girls, students, not only the students young, but also the age around 30. We call it the young protester generation Z, generation Y. They detain everyone. So the protesters put the barricades that so that the police cannot easily came in to stop the protesting. But they use the tear gas bomb, and then sound grenade bomb, and then rubber bullet, and also the real bullet. I had that experience. In one of the protests, like they shot with the real gun, and then at first I didn't know whether this is real gun or not, because I did not have the experience. I live and grew up in Yangon, so I have zero experience of what is the sounds of the real bullet. So I did not know that this is the open real bullet gunfire.
I see.
But I don't know. That's why. Yeah.
That must have been a frightening experience, Momo.
Yeah, I did not know I have to run. So, but my friends asked me, run, Momo, run. This is the real bullet. Run. You have to run now. So my friends and I ran away from this situations. Luckily, we are stay safe.
Yes.
But I saw the one young boy who is at age 19. He passed away.
I see.
He got shot on his arm. Yeah.
Momo, given the exposure to this sheer human brutality in Myanmar, I'm going to assume that concerns over COVID-19 pale in comparison. What are your thoughts?
I cannot imagine. Maybe we get some kind of herd immunity in the COVID-19, because I took the precautions of the COVID-19, but the mass gather around the country, and then maybe we get the herd immunity. I'm not so sure about that, but I'm hoping for it. And then the previous, the NLD government, the Daw San Suu Kyi government, they at first they plan to get the vaccine shot to the people on the in the February, but since like the military wonders, the regimes totally stopped the projects, and then but they got shot. The military, and then the military people got shot. But for the normal people like us civilians, we don't get the vaccine yet.
I see. So the military have been vaccinated, but the public has not. Momo, what has been the general public response to the protests?
You mean general public to the protests? For the protests, we don't want the military regimes. Since 1962, we are under the military regime. Military government rules the country. So our aim is we don't want them to come back and to cover the country again. We want the real democracy. So we are fighting for it. And then I think most of the Myanmar people are against them too. But the most difficult things and the thing is that they have the deadly weapons, but the people, the civilian, we don't have. So when they open fire, we have to run. Yeah.
I see. All right, Momo, thank you very much for your time and thoughts, and do accept our prayers for peace in Myanmar in the near future.
Thank you.
All right, then back here in Korea, cluster infections at workplaces in Gyeonggi province have led to calls for preemptive testing of all related individuals, including migrant workers. We have details in this report.
Hi, this is Jessica Lee. I'm in Wonggok-dong in Ansan City, Gyeonggi-do Province. The reason why I'm here today is to take a look at the makeshift for foreign workers here in Ansan City, and it's set up right next to the Multicultural Support Headquarters, as you can see. So people are standing in lines to get tested for the virus, and they are workers who are working in Ansan City, where it has highest proportion of foreign workers among local governments, and also where it has Panor Industrial Complex, which hires many foreign workers as well. So let's go inside and take a look at it.
The administrative order is targeted at foreign laborers who work in workplaces that employ at least one foreigner. Foreign workers who intend to work in companies in Korea must undergo the COVID-19 testing in advance as well. So, what is the reason for carrying out COVID-19 tests on foreign workers?
외국인들의 감염을 선제적으로 차단하기 위해서 외국인 근로자들을 배려하는 의미에서 시행하고 있습니다. 외국인에 대한 차별이 절대 아닌 외국인에 대한 배려, 그런 의미에서부터 시작된 행정입니다.
This temporary test site opens from 9 in the morning and it operates in the same way as other COVID-19 screening center. So it's free of charge for anyone, and once you enter, you have to write down this questionnaire. For example, you have to write down your name, your date of birth, and your sex, and also your phone number. And after filling in this information, and now you're able to get tested according to the guidance of a medical member here. So the test itself is done in a swift manner, taking into account the larger groups of test takers as well.
Since it is a center for foreign workers, signs are made in foreign languages. Let's see what foreign workers think about this administrative order.
지금 코로나 문제도 많이 심각하고 있는데 서로 진단받고 검사 받고 하니까 마음도 편안하고 좋죠.
It's free and it's very cool. Everyone have to come and do the test.
매우 좋지요. 이런 무료로 해주니까 이렇게 다 하니까는 좀 코로나가 빨리 종식됐으면 좋겠어요.
Illegal workers are no exception. They're strongly encouraged to get tested without having to provide personal visa verification, and they won't face any disadvantages such as deportation because the testing information is not notified to the immigration office. Currently, about 4,000 to 5,000 people are getting tested for the coronavirus in the city of Ansan a day. So what was the outcome of this preemptive inspection?
감염된 사람은 지금 약 3만 명 가운데 지금 17명에 불과합니다. 그래서 이제 그 17명에 대해서는 저희들이 빠른 조치를 시행함으로써 그 집단 감염이 되는 거 원천적으로 차단하고.
So what's the plan for these special makeshift centers from here on?
네, 저희 안산시는 이제 계속 이제 외국인 근로자들에 대해서는 거의 계속 주기적으로 검사를 하기 위해서 그런 찾아가는 이제 찾아가는 검사를 하기로 했습니다. 진단 검사를. 그래서 그 신속 진단 키트를 이용한 신속 항원 검사를 이용한 그러한 검사를 지금 계획하고 있고요.
According to Ansan City, it plans to keep the temporary testing centers in operation even after Gyeonggi-do Province's administrative order comes to an end, while monitoring COVID-19 figures for a while.
If you need any translation service, you can contact 1324 or 1330 at any time. And please be mindful that COVID-19 can be transmitted by anyone to anyone, not only foreign workers, and can spread to your beloved family and friends. And if you want to be on the safe side, it's highly recommended to get tested for the virus. This has been Jessica Lee from the Makeshifts for Foreign Workers.
세계보건기구 또한 이 백신이 감염을 예방을 하고 사망을 줄일 수 있다고 밝혔으며 아스트라제네카 백신과 혈전 간의 연관성이 없음을 확인하였습니다.
하루 300~400명대의 확진자 수가 2달 넘게 이어지고 있습니다. 우리는 지금 3차 유행이 안정화되느냐 아니면 재확산되느냐의 갈림길에 서 있습니다.
AstraZeneca has shared results from its US clinical trial. Its vaccine is reportedly 79% effective at preventing symptomatic COVID-19. This announcement, however, has been followed by concerns that the company may have included outdated information in its trial. Now, in response, AstraZeneca has vowed to promptly clarify its findings. For more on this, I have Dr. Alice Hyung-Tan from Miss Medi Women's Hospital. Welcome back, Dr. Tan.
Good afternoon.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Thank you for having me.
Right then, Dr. Tan, let's start with this latest development with regard to AstraZeneca's vaccine.
Right, so on March 22nd, as you mentioned, AstraZeneca, on their company website, they published interim safety and efficacy results. But it seems that it was just an interim evaluation up through February 17th. We should also, and the trial actually ran from August 2020 to March 2021, so that's why it was incomplete in terms of the analysis. The good thing about the phase 3 trial results, so this time around, is that up to 20% of the trial participants were greater than 65 years old. 60% of the participants had underlying comorbidities that we know can predict a severe disease such as diabetes, obesity, and heart disease. So I think at this point, because the company said that within 48 hours they will put out revised safety and efficacy results, it's best to, I think, just wait a little bit before we talk too much about what was posted on the 22nd, because they were preliminary. My anticipation is that whatever is eventually published will probably echo the findings of their previous other phase 3 results that were from the studies that were held in other countries. In other words, I think the bottom line will continue to be that AstraZeneca is a safe and efficacious vaccine. The only caveat is from this round of the study, the scheduling of the vaccine was 2 shots spaced 4 weeks apart, which is of course different from what we're actually going to be doing in our country, spacing the shots 8 to 12 weeks apart. And so it's quite possible that the effectiveness, the real world effectiveness, may even be better than the efficacy that they found in this latest phase 3. The other concern were safety issues, and they looked specifically at the risk of blood clots, especially cerebral vein sinus thrombosis. And according to their preliminary evaluation, there were no increases in these side effects of concern.
Right. Meanwhile, Dr. Kwak, AstraZeneca's vaccine is reportedly now 79% effective at preventing symptomatic COVID-19, like I mentioned earlier, and 100% effective at preventing severe COVID-19. How does this finding compare to those of Moderna and Pfizer?
So in comparison, they're about equivalent in regards to preventing severity of the disease from COVID-19 and also blocking the hospitalization for patients who have been diagnosed even after the vaccination. But continuing with what Dr. Tan has mentioned, we also need to keep a close eye on those factors that these are as effective, meaning these will still work very well as the Pfizers and Modernas do in all throughout the generations that they've been inoculated onto. So I think we can sort of keep our hopes up in the fact that we have already started vaccinating people with AstraZeneca, and we further have plans to further inoculate elderly people with AstraZeneca, and also the fact that it may prevent further severity and hospitalizations among, especially in the elderly. I think it's very high in prospect that we can foresee.
Right. Now, Dr. Tan, following the World Health Organization and the European Medicines Agency, a local panel of health experts here has also ruled out a possible link between AstraZeneca's vaccine and blood clots. And this is something that the company itself said it did not find during its US clinical trial. Do you believe this ends the controversy surrounding the safety of this vaccine?
Well, there are two different types of blood clots that we're talking about. One is sort of the more common type of blood clots that could happen in the deep veins of the leg, in the calf area, also veins in the lung. And for those more common types of blood clots, it does seem to be completely unrelated to the AstraZeneca vaccine in terms of statistical analysis. However, there are more rare types of blood clots that may be occurring in conjunction with low platelet counts. Platelets are a type of cell in the blood that cause clotting. And these reports, as I said, have been very rare, but they have occurred to the degree that it's considered an increased safety signal. And so the EMA, the European Medicines Regulatory Agency, they have actually changed the wordage of their patient information pamphlet to include a warning about these very, very rare blood clots. They can occur in the veins in the brain, perhaps also in the veins of the gut. And the strategy has been, in Europe, but also in Korea, is to make healthcare workers and also the public aware of what kinds of symptoms and signs to expect and what to do about it. So basically, if you have a very, very severe headache that does not go away after 3 days, despite taking typical headache medicines such as Tylenol, in conjunction with perhaps also blurry vision or decreased consciousness, you definitely need to go immediately to an emergency room, a fairly large-sized emergency room that has a CT scanner or an MRI. The other condition would be if you have unrelenting abdominal pain, or if you have easy bruising, or some red spots appearing on the skin, especially in the legs. These would all be signs of concern that you should seek medical attention for. The message is, one, these conditions are very rare. Two, they're treatable. And so even though there is a safety signal, no direct causality has been found, but we want to be cautious. And so that's the approach that's been taken right now.
And we want to be aware, of course. Dr. Kwok, moving on then, what is the significance of vaccinating the elderly as part of efforts to contain infectious diseases?
Well, as I partly mentioned before, so the elderlies are the ones that are most vulnerable to the disease. So by inoculating them, we're preventing them actually not just from getting the COVID-19 virus itself, but also preventing them from having more severe disease from it. Particularly, you might expect much lower death rate possibly from this. And also, we could also expect that much less burden on the medical sector from having the COVID-19 throughout the population. So in that sense, it's by inoculating elderlies first, we are getting very much of a hard grip on the fight against the disease, in a sense that because we can have these big portion of the people who are much more vulnerable to the disease, much safer, and then still go on with the fight against the COVID-19 among other age groups.
Right. And staying with such vaccination efforts, Russia is seeking to share its vaccines with the international community. And for more on those efforts, I have Dr. Stanislav Prichin live on the line, that is. Welcome, Dr. Prichin.
Thank you. Good morning.
Right, Dr. Prichin, Russia has approved 3 locally developed COVID-19 vaccines. And I believe President Vladimir Putin was inoculated earlier on Tuesday. How is the vaccination campaign progressing over there in Russia?
To be perfectly honest, this is not so smoothly developed because the population of Russia is too high on the one hand. And another situation with pandemic is not so bad in Russia. So according to official statistics, today we have something about 8 new people who registered as COVID-19. Comparing this with the peak of the second wave, when in January we had something about 30,000 people, this is a very good dynamic. At the same time, our obligations in relations with our partners and neighboring countries where the situation is not so well and not so good as in Russia make situation when Russia is sending more vaccines abroad to support its partners rather than to send it within Russia. So today we have something about around 5 million people who have been vaccinated so far. This is not so high percentage of population, but I repeat that situation in Russia with COVID-19 is not so bad.
I see. Meanwhile, Dr. Prichin, Russia's top diplomat Sergei Lavrov is here in Seoul for talks with his Korean counterpart Chung Eui-yong. Do you believe the two officials will discuss collaboration on the vaccine front?
So, as I heard, since last autumn, negotiations about the possible using capacity in pharmaceutical area industry in South Korea for producing Russian vaccines went on, and I hope this personal meeting will push this process and to start the using infrastructure of modern infrastructure on pharmaceutical industry of South Korea for producing Russian vaccine. The problem is that Russia invented 3 different vaccines, but capacity of Russian pharmaceutical industry is not enough to produce and to cover all demands within Russia and abroad. And this is the reason why Russia is looking for foreign partners for producing Russian vaccine.
I see. Meanwhile, before his visit here, Mr. Lavrov met with his Chinese counterpart, Wang Yi. Now, the two diplomats reaffirmed their countries' close ties, Dr. Prichin, and here they also touched upon vaccine efforts. Could you tell us a bit more about this?
This is very interesting that in the preamble of this statement, the problem of coronavirus was one of the key, but this statement devoted mostly the political consequences of pandemic and the global turbulence, the change of global order, and tensions in relations between Russia and China with the West. So in such circumstances, the main goal and the key issue of this statement is the common Russian vision of future world order, international law, human rights, democracy, Russian and Chinese common approach to these key international questions.
I see. All right. Dr. Prichin, as always, thank you very much for your time and thoughts.
Thank you.
Right, then back here in the studio, Dr. Tan, Korea is emerging as a strong platform of contract manufacture of COVID-19 vaccines. What appears to be fueling this trend?
I think there are 2 reasons. The first is our country has had relatively good control of the pandemic so far. And so what that means is in terms of personnel, supply chain, logistics, these have been able to just go forward without major breaks. And so, of course, the manufacturing has been fairly consistent. The second reason is because we have a fairly well-established biotech industry, and we have factories that have already received certificates of good manufacturing practices. They can ensure high quality control. And so I think those are the 2 reasons why we have been chosen as contract manufacturers. And so Korean companies have really been able to step up and deliver the kind of volume that's needed to beat the pandemic.
Right. And Dr. Kwak, how does Korea's manufacturing capacity look to affect our procurement efforts of COVID-19 vaccines?
Well, it's mostly in the logistics, as Dr. Tan mentioned. We're so advanced in the sense that we're making our own vaccines here. For the ones that are allotted to our country, we will be able to direct them not through the logistic from going overseas and coming back to their country, we could just direct directly to ourselves and get them inoculated. We are quite advanced in technology so that we are able to actually complete the manufacture. Not just coming up with the vaccines itself, we are able to actually complete it and package it in a syringe and vials so that we could actually just start bringing them to the people once it's just out of the factories. So in a sense, for the dosages that are allocated to our country, we will be able to, once it's manufactured in the factory, we'll be able to directly have them shipped to the people that are needing it and inoculated very immediately.
Right. Dr. Tan, let's shift our focus to the local outbreak now. Authorities have vowed to push the daily tally to fewer than 200 per day. Is this a feasible plan?
It's going to be really hard. We do seem to be stuck at a daily COVID count of somewhere between 300 and 400. It seems that once we address the fire on one side of the mountain, then we've got flames on the other side that we have to put out. Case in point, the good news is cases that are arising from nursing homes and convalescent hospitals, they have actually gone down by 75% over the last 1.5 months. However, now we have the problem of clusters arising in all of the high-risk venues that are now open for business, such as sports facilities, singing rooms, and nightlife venues. And so, we're having to deal on many different fronts with this. I think the worrisome part is that we're dealing with this on a background of slowly increasing cases of unknown epidemiological link. And among these cases are variants of concern. And we are now seeing more cases of variants of concern coming out of the community that have no travel history and are unlinked to other clusters. This is very concerning, and this could potentially be the start of widespread variants in Korea. And we know that the status quo in terms of infection control will not be able to control these more transmissible variants. And so, we may need to make the measures more strict if we do see more variants in the community. And it's going to be quite challenging going forward. The good news is our fatalities, the new fatalities per day, that number has been at or below 10 cases per day consistently for the last 1.5 months. That's very good news indeed. And so, we have a balance of good news, but challenges ahead.
Right, we do. Dr. Kwok, I believe authorities here have acknowledged a link between vaccinations and 2 cases of adverse reactions. Please tell us more about this.
Right. So even after the speculation of linked cases from the vaccine, the side effects that they speculated, our government has denied and proved that they were not linked to the vaccinations up until now. Many other cases still have been reported, but out of those 2 were reported to have been linked, and they're actually anaphylaxis cases. So they're not exactly the ones that are causing blood clots, for example. They're more of the ordinary side effects that could be expected from any sort of vaccinations. Even if we're injecting influenza virus, we could possibly warn them of possibility of having anaphylaxis. So these 2 seem to be those special cases. And of those 2, one person actually received epinephrine, and she or he was actually revived just right immediately and had no problem whatsoever afterwards. So in those cases, they were sort of expected. I cannot say that everyone should expect to have anaphylaxis because it's such a rare case, but those could happen just mainly due to not the type of the vaccination, but the vaccination itself, meaning any sort of vaccinations could have caused this, but they were linked to the injection of any sort of medication. So those were the 2 cases currently have been found of a linkage to the vaccinations.
Right. And Dr. Dan, out of these 675 people who received their first dose of the COVID-19 vaccine, 30 were infected with the coronavirus. What can you tell us about this reality?
Right. So we know that 13 of the cases occurred within 7 days of vaccination, and 17 of the cases occurred within 8 to 14 days of vaccination. In terms of the cause, it could be that the exposure to the virus occurred prior to vaccination, but the cases were diagnosed after vaccination because of the latent period. It could also be that the exposure occurred within the 2-week period before full immunity was reached. And these cases highlight a couple important things. First of all, immunity, full immunity after vaccination is neither immediate nor is it absolute. I mean, we know from the phase 3 trials that a few people will get the virus despite vaccination. It also highlights the need for us to stay vigilant, to keep with the infection control measures, to make sure that they wear the mask, distance, wash their hands, test if they have symptoms early, because we only have a few hundred cases at most who are fully, who have received 2 doses of the vaccine so far. Everybody else, has only received 1 shot, and this number is actually a very, very small percentage of our population. So I don't think these cases can be defined as vaccine failures, but we do need to keep our eye open for those cases in the future. And if they do occur, we will need to examine them very, very carefully, especially because they may be caused by variants. But also we want to examine why these people did not develop immunity after vaccination.
Right. All right, Dr. Dan, as always, thank you very much for your insights. And Dr. Kwok, thank you for being with us today.
Thank you.
Right, according to recent findings by authorities here, quite a number of COVID-19 cases as a result of direct contact with an infected person occur at home. So do seek to maintain prevention efforts within your household as well. Thank you for watching.